Okay.
Did it start? Or?
Yep, it's going. 3, 4.
Alright. My name is Lillian Erickson, and this is a video for health assessment professional skills. So I have my patient here is named Pat Smith, and we have a new order for regular insulin, 8 units IV bolus, stat, and then to follow with regular insulin infusion, 8 units per hour. So I've checked I'm going to check my orders with my MAR, and I'm going to make sure that everything is correct, all my information. I have the right patient, I have the right drug, the right dose, the right route, and the right time for this order. And then I'm going to go to my IV drug handbook, and I'm going to check the normal dosage, the dilution. It says that I can dilute for the infusion, I can dilute in 100 units of insulin to 100 milliliters of normal saline. So I'm also going to check the rate of administration. I can give 50 units or fraction thereof over 1 minute. So for my bolus, I want to give it over 1 minute. I want to check my antidote, and my antidote is glucagon, so I want to make sure that I have access to that if my patient has any adverse reactions. So I have checked all this. I've gathered my equipment, and then I can go into my patient's room. First, actually, I am going to draw up my insulin and put it in my syringe to give the bolus. I'm also going to take my regular insulin, and I have 100 units in 100 milliliters, and I'm going to prime my bag, or my tubing. And then I'm going to draw up, I have 100 units in this vial. So I'm going to compare this I'm going to be comparing this with my order. So I need 8 units, I can drop 8 units. Okay, so I'm going to inject 8 units of air into my vial, and I'm going to draw up 8 units. So I have 8 units in here, and I'm going to have another nurse check for me. And check the vial, as well as my other insulin. Okay, so I'm going to take a flush. I'm going to squirt out 5 milliliters, and I'm going to put my insulin into it. Recap my needle. Okay, so here is my insulin. I made sure that cap was sterile. Alright, so now I'm going to go into my patient's room. Take everything with me here. Alright, so I'm going to come into my room. I'm going to introduce myself to my patient. Hello, Mr. Smith, I'm your nurse today. We have a new order for you for a bolus of 8 units of insulin. So I'm going to give that right into your IV, and then we're going to hang a bag, and we're going to infuse 8 units per hour. I also want to check and do my checks, check his wristband. I'll have him say his name and birth date for me. I'm going to check for any allergies, and he does have an allergy to morphine, so he can confirm that for me, but that's irrelevant in this case. So I've checked that. I can also check my IV site, make sure the IV site there's no infiltration, no extravasation, phlebitis or anything. And my IV that is running also looks good. He has normal saline running, which I have checked is compatible with the insulin I'm going to be giving. So I'm going to again check my MAR, check everything that I have, and I'm going to push my curtain over to make sure that I have privacy for my patient. So I'm going to again check. I brought my vial in so that I can do my other check for insulin. And here is 5 milliliters, and that's what I've diluted my insulin in. So I have 8 units in there. I have my 2 flushes and my infusion. Alright, so I know that I have fluids running through here, so I know that the IV is patent. I've looked at it. So I'm going to give my bolus. I'm going to take an alcohol swab. And I'm going to clean off my port. While I'm at it, I can just clean this off too. And I'm going to do that for 15 seconds. And I'm going to make sure that I don't let this touch anything so it remains sterile. And I take off. And this is my insulin, and I do know that I have to give it over 1 minute. And before I would do this, I would actually put on my gloves. So I'm going to do that real quick. Before I would clean off my port, I would actually put on my gloves. So like I said, I know that I need to give this insulin over 1 minute, so I can give it in increments, and I'm watching the clock over 1 minute. So that's 1 in. And since I dropped that, I would also alcohol swab it off again. And then I have my flush, and I'm going to put that on. And I'm going to watch the clock again and give this over 1 minute, so I make sure that the insulin goes all the way through the tubing over 1 minute. Alright. So that was my bolus, and I'm watching my infusion site as it goes in, making sure that there's no infiltration. So now I can go over to my infusion, and we're going to pretend that there's a cap on here. There's not, but we're going to pretend. So I'm going to be putting the insulin into this port here so that I can run it concurrent with the fluids that I have. So I'll alcohol swab this off for 15 seconds. Alright, and now I'll take the cap off of this and put it right on there. I'll unclamp my tubing. Alright, and then I'm going to, I know my A is already set, it's running, and so I'm going to go to line B, and I'm going to set it. I know I have 100 units in 100 milliliters, and I need to have 8 units at over 1 hour, so I know I'm going to set it at 8 milliliters per hour. And I'm going to choose concurrent, 8 milliliters per hour, and I have 100 milliliters, so I'm going to put about 75 milliliters to be infused. And I'm going to press start. And so I'm going to monitor my patient, make sure that there's no complications with his site, make sure that he's feeling all right. And that, I believe that would be the end of this skill.